These behaviors are not a normal part of childhood, period. It's not normal, okay? Get your child help ASAP if they exhibit either of these behaviors. In today's video, I'm gonna share with you 7 signs that your child needs therapy. This video is for anyone who has a child in their life who they care about. It could be your own child, it could be a grandchild, a niece, nephew, cousin, neighbor. Maybe you're a coach or you work at a school. If you have a child or children in your life that you care about and interact with, you will benefit from knowing these 7 things. Quick introduction. My name is Ramsey Dean. I'm a licensed therapist, and we talk all about mental health education on this channel. So make sure you subscribe if that interests you. Before we get into the 7 signs that your child needs therapy, I want to share a little bit about my background. So I am actually not a child therapist. I primarily work with adults. However, before I became a therapist, I worked for many years in child protective services. So I have a lot of experience working with kids who have complicated trauma, mental health and developmental issues. Also, for both of my degrees, my bachelor's and my master's in social work, I chose a child and family concentration. So that came with extra classes in child development, family systems, things of that nature. I also worked in an emergency room for several years doing mental health crisis evaluations, and that was for all ages. And I evaluated many children and adolescents in that time. So I do feel that I have a lot of expertise in spotting troubled emotional development in children, even though I'm not currently working with kids. 2 quick disclaimers. Number 1, children are complicated. Child development is complicated. Just because your child has one of these 7 signs does not necessarily mean there is a problem. I will encourage you that if you see any of these 7 things in a child you care about, to just be curious. Don't jump to conclusions, don't panic, don't get angry with me and cuss me out in the comments. Just be curious and consider whether investigating further could be helpful. With the exception of number 6 and number 7, if your child is experiencing either of those, that is a sign that they need immediate mental health treatment. Number 2, I always recommend starting with your child's primary care physician if you have any concerns. Many of the things I'm going to talk about can be caused by medical or other health issues or learning disabilities even, so make sure you've had your child medically cleared before you assume there's an emotional or behavioral issue at play. All right, number 1 is a lack of interest. Children are naturally very curious and involved in their environment. If you have children or have ever been around kids, you know they get into everything. This exploration of the world and their surroundings is a very healthy and important part of child development. If you have a kid who once was interested in play and school and their peers, and now all of a sudden they just don't seem like they care, that is cause for concern. If there's not a medical or other developmental issue going on, then there's almost certainly some type of emotional issue at play. Children at baseline are full of life and curiosity, and lacking interest is just a huge red flag that something is going on with that child that needs intervention. Number 2 is regression. Think of the expression, it's like learning to ride a bike. You never forget. This is so true when it comes to children. They are getting bigger, smarter, more skilled and well-adjusted every single day. It's one of the most amazing and rewarding things about working with kids is seeing them progress and mature. If kids master a skill like reading, writing, language, math, learning to use a toy or play a certain game, for example, they shouldn't start to go backwards or backslide with those skills. This can also apply to their behavioral development. Like, it's not typical for a child to start bedwetting again, for example, or thumb sucking, or speaking in baby talk when they've already moved beyond that. This isn't to say that children won't have hiccups here and there, but generally speaking, we should see their development move in a consistent upward trajectory. And if you're noticing regression, it is worth taking a closer look to see if there is an emotional or behavioral issue going on undetected. Number 3 is changes in academic performance. Kids can get poor grades for a large variety of reasons. Maybe they have a learning disability or an intellectual disability, for example. However, those types of issues are usually apparent pretty early on for kids. So if they've demonstrated the capacity capacity to do well in school and suddenly that changes, I would at least be curious, is there some type of emotional or behavioral problem that is precipitating the change in their academic performance? Maybe there's bullying going on at school. Maybe the child has endured some type of trauma that you don't know about that they haven't disclosed to anyone, and it's impacting their ability to regulate their emotions and focus on school. Maybe the child is abusing drugs or alcohol. Maybe the child is depressed or anxious or has some other type of emerging mental health issue that is showing up as poor academic performance. I could go on and on about the potential theories, but whatever the reason is, the sooner we can intervene when a child is struggling, the more likely we can nip it in the bud before it becomes a totally out of control issue that's hard to treat. Number 4 is separation anxiety. This is actually very common in kids, and because of that, I think sometimes we can be quick to dismiss this as not a problem. Starting as early as 6 months, you may see signs of distress in a child when they are removed from their parents or caregivers, and this typically continues up until the age of 2 or 3-ish, maybe a year longer in some cases, and that's totally normal. After the age of 2 or 3, kids who show lots of distress when they are separated from their parents may have what's called separation anxiety. Usually what's going on is the child worries about something bad happening to their parents. They may worry about going to bed alone. That's a big sign. And remember, kids don't really have the emotional processing skills to understand and label what's happening to them as anxiety. Some adults don't have those skills either, by the way. So instead, we see meltdowns when they have to be separated from their parent. We see them complaining about stomach aches or headaches when they have to be away from their parents. Although separation anxiety is common in kids, if it continues past the age of 4, if it's causing the child significant distress or impairing their ability to do their daily routine, or if the school is bringing it to your attention, those are all signs that the kiddo may need professional intervention to nip that anxiety in the bud so it doesn't blossom into a more pervasive issue. Number 5 is excessive temper tantrums. Don't get me wrong, tantrums are a normal part of child development, and not every child who has tantrums will need therapy, or like literally every child on the planet would need to be in therapy, because I don't know any child who's never had a temper tantrum. And there's still a couple things I want you to know and look out for. Okay, temper tantrums are common. They usually start during the toddler years when children are learning to assert their independence, but still have limited communication skills. A lot of times they are triggered by frustration, fatigue, hunger, or a desire for autonomy, and the child doesn't have the skills to communicate these needs in a healthy way. So it comes out as a tantrum. This usually continues throughout the preschool years, so until age 4 or so, but starts to lessen as the child gets older. So when should you be concerned about tantrums? If they are continuing as the child gets older, so they're in kindergarten or first grade, for example, and they're still having frequent tantrums just like when they were a toddler, that's a concern. If the temper tantrums are very intense and involve extreme aggression, like hitting, biting, throwing objects, that could signal a deeper emotional problem. If the tantrums are very frequent, like multiple times per day, and they last for more than 15 to 20 minutes, that could indicate an underlying issue. If the child's temper tantrums are impairing your daily routines, so if the child is having frequent issues at school or daycare, for example, you're getting a lot of calls at home from teachers expressing concern, that's not a good sign. If you find as the parent you're consistently distressed or overwhelmed by your child's tantrums, you feel like there's certain things you can't do in your daily life with your child because you're concerned they're gonna have a meltdown, that's also cause for concern. Again, this is a tricky one because tantrums are a normal part of child development. I want to make that clear. But look at the frequency, the intensity, the impact on your child's functioning, and if it seems like it is above and beyond what's normal for their age, consider investigating if it could be indicative of an underlying emotional issue. Number 6 is any type of self-harm. This always, in my opinion, requires professional treatment. Please get your child an appointment with a licensed mental health professional if they are engaging in any type of self-harm. This could look like cutting themselves, burning themselves, or headbanging, for example. These types of behaviors are most common in teenagers who are struggling with difficult negative feelings such as distress, self-loathing, depression, and anxiety. For teens who engage in self-harm, the urge is usually very strong, frequent, and hard for them to resist. Teens who experience this can rarely stop on their own, or in response to their parents just telling them to stop. This needs mental health evaluation and treatment to help figure out the underlying cause for the self-harm and to help the teen learn other more adaptive ways to cope with their emotions. You may think that this is obvious, but I have learned over the years that it's actually not. I cannot tell you the number of times I've worked with parents who are dismissive or minimize self-harm behavior in their child. I've had parents say to me things like, "They're just doing it for attention." Or I'll never forget, many years ago, I had a parent say to me, "What teenage girl hasn't thought about killing herself?" Now, I don't want to demonize parents, but the point I'm trying to make is that not everyone is aware that self-harm in teens is a sign of a serious underlying emotional issue. And in my opinion, it requires professional treatment, and the longer you let it go unaddressed, the worse the problem usually gets. Number 7 is hurting animals or setting fires. These behaviors are not a normal part of childhood, period. It's not normal, okay? Get your child help ASAP if they exhibit either of these behaviors. And I'm not talking about a young child who doesn't know how to hold the cat appropriately and is unintentionally rough, or a middle schooler that plays with a lighter one time. I'm talking about intentional behaviors, kicking, hitting, or torturing animals, intentionally and repeatedly setting things on fire. Animal cruelty can be a sign of aggression, a lack of empathy, issues with power and control. In some cases, it may also be an indication a child has been exposed to violence or trauma that was inappropriate at some point, and now it's manifesting in the form of animal cruelty. Research has shown that animal cruelty in childhood is often linked to later involvement in violent behaviors towards humans. So again, get these children help stat, please. With fire setting behavior, sometimes it's driven by a fascination with fire, a desire for excitement, or an attempt to release pent-up emotions. Fire setting can also be a sign of poor impulse control or unresolved trauma as well. It's also just a very dangerous behavior. It poses a lot of risk for the child and also the people around them. And there you have it, 7 signs your child needs therapy. Let me know in the comments if you are interested in a part 2 of this video. There's honestly so many more things I could share, but just did not have the time to include it today. If you have found this video helpful or informative, then please give it a like and make sure you subscribe to my channel. It really helps more people to be able to access the education I'm trying to provide. I'll catch you here in the next one. Take care. Bye-bye.
Take off your halo, you're beautiful. I don't care if it tears me apart.